Hello all, this is Dr. Dave Maslach talking to you about reciprocity.com. The E is written with a 3, and in this particular video I want to talk about getting health insurance during graduate school and whether you should get health insurance during graduate school. So if you don't know me, I'm a professor of innovation strategy and entrepreneurship, and I created this whole reciprocity project to give back as much as I possibly can. There were so many people that helped me out during graduate school that I want to create something that was larger than me that helped out a lot of other people. So I did this sort of sharing economy proofreading platform thing that I built out. That's Reciprocity. And then now I'm doing these YouTube videos to help get the word out. All right, so health insurance during graduate school. Should you get it and should you not? Yes, you should definitely get health insurance during graduate school. I'm never ever going to recommend that, but the sort of reasons behind it are probably different than what you hear about in terms, and it's a little bit more specific towards graduate school, why you should get health insurance. So I came from Canada. And let's just start off there. And they have universal health care there. So we didn't have to make a lot of these decisions. However, there was something unique. They didn't have sort of pharmaceutical and dentist care or anything like that, right? So it's a little bit different than what they have in the United States. All of those were private. And I chose not to get the pharmaceutical insurance, which was so stupid at the time. Now I look back and I'm like, that was really poor decision making for a lot of different reasons. But the dentistry, I choose not to get my own health insurance even now because it just doesn't sort of the marketplace doesn't quite make sense with insurance at this moment in terms of how it is priced out. So I've done this analysis a fair bit and it just doesn't quite make sense. But with health insurance, particularly in the United States, you have to make sure that you have health insurance, particularly as a graduate student. So you should get enough money to pay for, out of your stipends that you get, to pay for health insurance. And you should look for ones that are going to reduce the amount of stress and anxiety that you have. So there's two major reasons why I'd recommend this in graduate school. The first one being is, yes, okay, you get good programs and stuff like that, sort of healthcare programs at any particular university within the United States. They take care of you. They generally do. At any reputable university, they're going to take care of you and give you options that are decent. However, it is when you're in graduate school, most people don't realize this, but you're way more prone to get some sort of injury because what you're doing is you're sedentary for a long time. So for most of us, you're used to kind of moving around and kind of doing your thing. And then you go to graduate school and all of a sudden you're like, you like sit down and you sit there forever for a long period of time. And then every once in a while you're like, I'm going to go do some exercise. You go do some exercise after sitting around for a couple of days, and then all of a sudden you're prone to injury. So a lot of people, the vast majority of the people I know, they're going to gain weight during graduate school, which is, it's got healthcare issues associated with that, as you know. They are going to, experience depression and things like that. That's absolutely normal to go through that. I know it's miserable to sort of say that, but that's truly is normal to go through depression during graduate school. And anxiety and things like that, sort of mental health care kind of stuff, mental health stuff. And then because you're sedentary and then you do exercises, you're prone to getting different injuries like, I had T-band issues going on with my legs. You get like neck issues. I pulled a muscle in my back after going to the gym, and it was months that it was. I couldn't do anything. When I became an assistant professor, I ended up herniating a disc in my back, and all these kind of things, and that's totally normal. Everybody I know that does this, unless they're extraordinary in some sort of way, extraordinary athletic or extraordinary sort of their body just works. Everybody I know kind of experiences these kind of things and they go through all this kind of healthcare issues. So very, very important because of that, because you're just going to go through, you're much more prone during graduate school or doing the work that you're doing to get injuries, and those kind of injuries, right? Like because you're sitting around doing nothing and then all of a sudden you do stuff. And that's normal to go through all that kind of stuff. So make sure that you do have health insurance because of that. And then the second thing that I think is important, and it's more of kind of a behavioral thing that happens, is having healthcare kind of reduces the stress in your life. So what you're doing is you're taking some stress off your shoulders that you're worrying about and giving it to somebody else. That's really all insurance is to imagine it as like lifting stress off your shoulders. So instead of worrying about, do I have enough money to deal with all this kind of stuff going forward, what you can do is just give some money to somebody else and they're going to worry about it, right? So you give it to the insurance agency to worry about that. So I personally opt for, I know that lots of people would suggest, particularly in the United States, to opt for like high deductible plans. I don't actually, and the reason is it's all behavioral. I opt for, we have a really good HMO in our city, and I believe it's just like Blue Cross, but it's like HMO for the specific city. And for those of you from around the world, that just means that there is like healthcare center for your specific city. And you can get health insurance anywhere. You can go get healthcare anywhere within the United States, but within the city, you have to go to these particular healthcare providers. And the physicians and things like that. So anyways, I pay extra to get this particular plan, and then we just can walk into any doctor's office. The high deductible plan has this like, you pay everything up front, and it's up to like $2,000, $3,000, or $4,000 or $5,000 or something that you have to pay. I think it's like $5,000. You have to pay everything 100% up front, and then the health insurance kicks in. So what that does, the problem with that plan, while it makes financial sense, and it truly does make financial sense to do that plan, it is, you're going to save money doing that, and over the long run, that's going to add up to lots of money. However, the problem is it's a disincentive to go to get healthcare, and it's also a stress thing. So you're always going to have to worry about that there's money in your bank to pay for all of whatever something happens, right? So you're always kind of a little bit stressed out because of that. So what's really nice is I don't have to worry about it, and that makes a huge, huge difference on me and my life and stress and things like that if I don't have to worry about it. And that's really the nice thing. And I know, and that's the whole sort of argument, right, is that I'm not incentivized to worry about it. That's the argument against healthcare within the United States. I'm not incentivized to worry about it, so I don't really care how much it costs. Well, that's a good thing in terms of my personal life at this moment, because I don't have to worry about it. I'm not stressed. And I could focus on actually being productive and doing the things that I need to do. And particularly if there's like a sort of catastrophic event that happens, we just go to the doctor, right? So I've gone to the hospital and things like that and just go to the doctor, and that's okay. So in terms of what I would recommend for you, I recommend just getting some healthcare insurance. And I know it's illegal at this moment not to have it, or there's penalties associated not to have it. But just make sure that you always have health insurance at all times. And, in terms of the other ones, dentistry generally doesn't work out financially in your favor. I've found out if you look into it and you investigate it a little bit deeper. I want you to look into it though, but don't just take my word for it. The pharmaceutical stuff, make sure you always have that as well, because that can be very, very costly. I study medical devices and pharmaceutical industry, and the way that they make their money is by, to do drug discovery and medical device discovery. They have to spend an awful lot of money to do this kind of stuff. And then the way they make the money is charge you a lot at the end of it, right? So just know that stuff can be very pricey, particularly if you get things like cancer or whatnot. And it happens. It truly does happen to everybody. You have a 100% chance of dying. You truly do. And at the end at the last couple months of your life, it's going to be extremely costly. That's the healthcare economics behind it. It gets extremely costly, and that's the last thing you need to be worrying about at that stage. You should be worried about just living life at that moment. So make sure that you have healthcare insurance when you're in graduate school. I speak very, very strongly for you, and choose the ones that's going to reduce the amount of stress for you. It's already stressful. You're already going to be freaking out during graduate school, so just choose the one that makes you less stressed. going forward. So hopefully that makes sense. Give me a thumbs up if you like this video, and do subscribe to the YouTube channel. All right, take care. Bye.